My name is Ellen, and I am the Programs Coordinator at Arthritis Consumer Experts. Welcome back to the 8th annual CR Arthritis event at the Canadian Rheumatology Association and Arthritis Health Professions Association Scientific Meeting. Today, I am joined by Cristina Montoya, registered dietitian in Ontario, Canada, a fierce patient advocate, and someone who's living with Sjögren syndrome and rheumatoid arthritis. She actively participates in Durham Region's Sjögren syndrome support group for the Sjogren Society of Canada, as well as the online consumer panel for the Arthritis Society. Welcome, Cristina. What a pleasure it is to finally meet you.
Thank you so much, Ellen, for having me. It's a pleasure to be here.
Cristina, would you mind sharing with us a little bit about your journey to becoming a dietitian, a patient advocate, and now sharing your story through social media to inspire others?
Well, my story as a dietitian really started in Colombia when I was probably 15 years ago. I decided to study nutrition. Although my focus was completely unrelated to arthritis, I was more focused on food security and other programs in Colombia. When I came to Canada, things shifted. I still had to study another 2 years. So I basically studied like 8 years of nutrition to become a registered dietitian here in Ontario. And that after that work in many areas until I had my baby about 3 years ago. Like we got 3 years old. He's turning 3 this week, and he was my miracle baby. And one of the things that really became passionate about is that when I started to see a little bit of more, I don't know, a disadvantage or kind of lack of care of women in pain or rheumatic conditions. And so I started thinking, well, maybe I could use my voice, my lived experience to raise awareness, educate others, and maybe they don't have to go through what I've been through and through my journey as a patient.
That's an amazing story. And, like we were chatting about before, maybe things happen for a reason to get you to the space where you are truly making a difference.
Thank you. And I think what I passionate about is that nutrition is like a hot topic.
Oh yeah.
Everybody, oh my God, everybody knows everything. And I just have the solution for you. And when you live with chronic illness, you have like unsolicited advice constantly coming to you, and especially with food. And even ever since I was diagnosed, even like 20 years ago, still the same advice. It's still the same advice. And then I'm thinking, well, I really went to school, like studying bioscience, biochemistry, 6 years. People, they go to study for 1 year. They feel like they know everything about you, but really when you study nutrition, registered dietitian can apply like a medical nutrition therapy and really understand what you're going through physiologically, pathologically. So that's what makes a difference. If you're going to go for registered dietitian, when you are there for the public, not really to make that profit or make false promises. You just cannot tell
Exactly.
them how it is.
Yes. And I think, like you said, there's so much literature going in so many different directions, which I find so interesting in nutrition. And to have someone who truly understands the biochemistry, right, has that the years of really solid foundation to help guide your kind of patient centered approach and medicine and therapy is so important.
It's it really makes a difference, and especially when you work in different settings, right? Working from the
Mhm.
hospital setting and long-term care. But I always love really working with people. Like that was just one-on-one, like counseling or groups. I love education. I really do.
And I'm sure they love you as well. Cristina, can you please explain to the audience what Sjogren's disease is and some of the common signs, symptoms from both, the perspective of an allied health professional and a consumer?
Yeah, so Sjogren's syndrome is one of the autoimmune conditions. It's an inflammatory and autoimmune disease. It's not really a condition. It is specifically attacks like the moisture producing glands, like the glands that produce saliva, glands that produce your tears and even in your skin, like as you're dry everywhere. But then on top of that, being an autoimmune disease, when that immune system attacks you, then it can also attack any organ. So your lungs, your gut, your heart, like anything can be attacked at any time. Sjogrens, like the main symptoms really is dryness. So dry eyes, dry mouth, fatigue, and pain, and joint pain, joint muscular pain. So those are like the most common um, symptoms. Even up to 95% of people, they're going to feel dryness at one point in their Sjogren's journey. It may not start at the beginning, but it might come. And in terms of like what I extra glandular, like how they call it, like other manifestations, is more really it could attack like the gut, and that has really been my focus and my outcry. And I say, Sjogren, if you don't have saliva, like it has to really affect everything else in your gastrointestinal system, just from the beginning, from the moment you put food in your mouth.
It's exactly it, right? Everything is connected, especially because it's all downstream, right? And I think we don't like realize the importance of saliva. It's like, yes, our mouth produces moisture to help us digest, but it's way more than that, right?
Absolutely. And you think like saliva, well, like, yeah, we take it for granted. And I thought that when I showed the presentation, that image, that I just took the time to actually measure the water. And I said a healthy person could produce up to 1.5 liters of saliva a day when it's stimulated, or even more. A Sjogren's patient, maybe a cup of what equivalent to a cup of water, maybe. And that's when we started seeing the imbalance. When we start eating, we need that saliva to protect our teeth, to prevent even the entry of viruses or bacteria, because that's kind of our first defense mechanism. And then on top of that is that it helps us to swallow safely and to enjoy our foods. Without saliva, in terms of quantity and quality, we can't really taste food, right? Like when you
Yeah.
have COVID, it's like, what are your symptoms? Loss of taste, smell, dry cough. And I said, oh my God, I have all those symptoms all the time.
Oh no.
So it was, and that's what it is. It starts in your mouth. And without saliva, you don't chew properly. You tend to just put the food in your mouth and just kind of immediately sip up water. So it facilitates the chewing, but then that also affects the kind of the process, the healthy digesting process, because once it goes to your stomach, the food hasn't been chewed out properly. So that the stomach has to work even harder, and that becomes another issue. So that's what I advocate for.
And that's what you presented at the scientific meeting. And I really loved your presentation because it was, like you said, it's something novel that we don't truly understand yet, this area. And I would love to ask about some of the trigger foods that you had mentioned, because I myself, have learned from, unfortunately, personal experience too many times, that these foods agitate me and increase my inflammation.
Yeah, it's very specific with Sjogren. So regularly, we don't want to be kind of recommend a restricted diet with patients with autoimmune diseases. But then I did find on my literature review that with Sjogren's, there's actually evidence that their gluten sensitivity, and that might have something to do with that, like a small kind of grade of inflammation caused by the Sjogren's, because the Sjogren's really attacks the epithelium, like almost like the skin, and that covers the gut, the gastrointestinal gut. So there has been studies, even from the 90s, that they have shown patients with sensitivity to gluten, and even their incidence of celiac disease, so that other autoimmune disease where there's a reaction to the gluten, is patients with Sjogren's have a higher risk of having CD, even up to 14%, from 7 to 14%. The health, like for the general population, the risk of celiac disease is 1%, just like, But for a patient, you have Sjogrens, you even that risk increases to 14%, up to 14%. And even if you don't get diagnosed with celiac disease, there are chances that you're gonna have gluten sensitivity. And other foods that they have found sensitivity in patients with Sjogren's is dairy products. And that has also been documented from the 90s in small kind of clinical studies. And I have seen it. And sometimes I see it at a certain degree, not completely all the dairy. Sometimes it's more towards lactose intolerance. So even adjustments to the sources of lactose have relieved symptoms in some of the patients I had. I personally experienced those two sensitivities to dairy, mostly the milk itself, and gluten 100%.
I'm on the same boat with you. Those two, I think you just hit the nail on the head. I'm like, those two, I gotta watch out.
But this is where it gets tricky. And that
Mhm.
was also the message that I wanted to roll out, because we have such an increased risk of celiac disease, where the only treatment is a gluten-free diet. So what happens, like people with Sjogren's, right? They started reading up on nutrition, and they start eliminating gluten right from the get-go, right? And
Yes.
so if for some reason you do have celiac disease, you're not going to test positive because you're already eating a gluten-free diet, which is the treatment for that.
Right.
So then what happens, the risk is that maybe you don't go 100% gluten-free. You still have those cheat days. Or maybe you can eat the foods that says it may contain wheat, right? Or barley. So you're still consuming small amounts of gluten. So you will never really know if you have that other autoimmune disease. And then eventually that may be also causing problems. You're feeling more fatigue. You're maybe blaming it on Sjogren's. It might be another autoimmune disease.
Yeah. And the other food I wanted to ask about was caffeinated beverages and carbonated beverages.
And oh, with Sjogren's, I guess it gets tricky because one of the things, the caffeinated beverages and carbonated beverages, they cause dry mouth. So regardless of what you eat, even if it's decaf, you still feel that kind of aftertaste, right?
Oh yeah.
And it's because we don't have saliva, we can't clear it. So that then, unless you rinse your mouth with a little bit of water with baking soda to kind of put a little bit of buffer in your mouth, so it's more alkaline instead of acidic, then still you can enjoy your coffee, right? But I will say just not in excess, because you're just going to feel very uncomfortable. And so it's not like it's pro-inflammatory per se. A cup of coffee just still can contain antioxidants. It's more what it can do to your mouth and your teeth. And the same thing with carbonated. But the carbonated drinks, honestly, they're the devil. I actually fear them more than coffee, because the carbonated drinks, they're already acidic. It's like
Right.
you're just kind of peeling that enamel off. And even if it's a Sprite or something clear, you're still putting acid in your mouth. And that's something you don't want to do. You're just feeding the bacteria there and causing more problems in your mouth.
Okay. So those two, tread with caution if you are consuming. Probably speak to your dentist if you would like to, drink a small
Mm-hmm.
portion of one of them, what to do right after. I've been very lucky to have some guidance on that topic.
Oh, that's great. Because and not only with the carbonated drinks and also caffeine, but remember that up to even 30% or 40% of patients with Sjogren's can have dyspepsia or gastroesophageal reflux. So meaning that there's still, those are gut irritants. So from on one hand, right, it's going to irritate your mouth, but on the other hand, it can actually exacerbate your reflux. And you want to make sure that you want to keep that under control, because remember, you don't have enough saliva to clear your esophagus, and you want to maintain it alkaline and safe, so there's no growth or any further discomfort. Because there's like a development of Barrett's esophagus where it could be cancerous. So you want to really protect your gut
Beautifully
100%.
explained. Thank you. And Christina, do you have any wellness tips, resources that you can share to help improve a patient's disease journey or health outcomes? Where should we be looking as patients?
Well, right now I'm posting a lot about Sjgrens on my Instagram account at Arthritis Dietitian, and I'm going to start posting more about it on my website at arthritisdietitian.com. But this year, my goal is I'm writing a book on Sjogrens and digestive issues. And that's my goal for 2022. And so, but things that you want to make sure when it comes to Sjogrens, always stay hydrated. That's really a must for us. When you're eating, avoid, again, those carbonated drinks, caffeinated drinks. Go for softer foods, foods, cooked vegetables. Don't make yourself suffer eating like a kale salad because that's what the influencers are telling you to eat. No, you eat what is comfortable for you. You want to make sure that you're helping your gut to absorb all those nutrients. Also, and just follow that anti-inflammatory nutritional way of eating. And I have a really great resource on my website. When you subscribe to my website, you will have the anti-inflammatory plate builder. So it will tells you the anti-inflammatory foods from each food group that I think will find you very, very helpful.
Wonderful. We will definitely link that below the video so everyone can check that out, and super practical resources. Thank you, Cristina, so much for your time, your wisdom, and really, I love your spin and your take as both an allied health professional and patient.
Thank you so much for having me, Ellen. It's a pleasure.
With that, we are going to thank our audience for joining us, and we hope you tune in for more.